So, as I'm sure everyone is aware, December is a magical time, but can also be a time that amplifies financial strain and emotional fatigue. So, today's session isn't about cutting back on coffees or cancelling Christmas, thankfully. It's about acknowledging real pressures, real emotions, and real ways forward. So, we've brought together a team of experts from across data, clinical support and financial well-being, our lovely Emma Gibbons, Antony Price, Leah and Stella, who I'll be handing over to. And our purpose for today is to share insights from a full year of supporting people through financial worries from MHI. And secondly, to highlight how money and mental health feed into each other. And third, to equip you with knowledge, empathy, and practical strategies so you can better support yourselves and the people that you work with. So I will hand over to our lovely Stella from Mental Health Innovations.
Hello, everyone, and thank you for joining. My name is Stella, and I'm part of the Data Insights team, where I lead on qualitative research for a deeper understanding of the concerns and issues that texters contact the service about. So today I'll be sharing insights on from MHI's data on texters who reach out about financial difficulties. Over the past few months, we have been analyzing trends and conversations to better understand how money-related stress is impacting the people who use our service. My presentation in this session brings together quantitative data, insights from qualitative analysis and texter feedback, to show not just the scale of financial concerns, but the emotional impacts behind them. So in the last year, financial difficulties were mentioned at about 3% of all Shout's conversations. That's roughly 17,000 conversations with 11,000 texters. What's really striking is how different the demographics look compared to our typical texter profile. 70% were aged 25 or over, which is double what we normally see for this age group contacting the service. 30% identified as male, which is almost twice the usual proportion of males that reach out to us. And nearly 2/3 reported experiencing a mental health problem alongside these financial concerns. So basically, those that reach out are a group that are not only facing financial strain, but also carrying a high emotional and mental health burden. Next slide, please. For our mix service, we've also seen an increase in money-related concerns. Since 2020, mentions of financial difficulties have more than doubled. And online financial harm is a common trend, and we recently ran a survey with 159 young people to understand the experiences of online financial harm, and we learned that basically awareness is high. Most hear about scams or harms through friends or family. Financial harm is common. Only about 1/3 had no experience of it. It's hard to talk about. So feelings of shame, guilt, and fear stop many from asking for help. And there are disparities. So young people on free school meals and those with disabilities are disproportionately affected. And finally, when asked what support they want, young people emphasized they wanted someone to talk to, online resources, chat or text support, and self-paced learning tools. Next slide, please. So to get a deeper understanding of why texters reach out to Shout about financial difficulties, we carried out the thematic analysis of anonymized conversations. The aim was to uncover the emotional and psychological factors driving people to seek support. So essentially, not just what the financial problem is, but how it feels. We also examined differences across age groups, so from 13 and under through to texters over 65. And this allowed us to identify age-specific pressures and see how financial strain shows up differently across the lifespan. Next slide, please. So across the data set, 5 consistent themes emerged. I will discuss each one in more detail. The first theme is fear of financial instability. So basically, texters worry about their ability to keep up with bills, rent, mortgage, groceries, and ultimately debt, as many usually take out loans and struggle with repayment. The second theme is stigma around money issues. Texters discuss shame about asking for help or admitting difficulty. To the loneliness and isolation. So because of shame, many experience loneliness and isolation as they feel they have no one to confide in. There's loss of purpose and self-worth. So financial strain often triggers feelings of failure or hopelessness. And finally, fear for loved ones. This was particularly among younger texters who worried about their parents' ability to afford essential items and the strain this financial pressure placed on them. So overall, texters reach out to Shout, not just because of the financial strain itself, but because of the emotional weight and the mental impact of these pressures. Next slide, please. So this slide kind of summarizes the full results of the thematic analysis and highlights how financial pressures affect mental health, social connection, and well-being differently across the lifespan. So texters under 18, so young children and teenagers, they usually absorb stress from their parents' financial instability. They also worry about basic needs like food and school-related expenses. And this often happens when a parent loses their job, becomes too sick to work, passes away, or when parents divorce or separate. And then suddenly a two-person household becomes a single-parent one, and children or young people begin to worry about the remaining parents' ability to cope financially. Texters aged 18 to 24 face worries about rent, tuition fees for those at university, and entering employment, and many feel pressure to support their family finances. Texters aged 25 to 54, so this wide age group, they face financial instability through bills, debts, job insecurity, and housing costs. Texters in this group also face compounding responsibilities of caregiving and financial provision to their children alongside financial instability, so it can be quite overwhelming. Those aged 55 to 64 often worry about insufficient savings and needed to work longer as retirement approaches. And this group also worry about health issues that may affect their earning ability. Older texters, those aged 65 plus, they struggle to afford essentials, housing and care. Fears about losing independence and feeling like a burden is quite common among this age group as well. And what we find is that across all age groups is the experience of isolation. So basically, due to limited finances restricting their social life and hindering them from participating in social activities. Loneliness is also an issue because of people's hesitation to open up about their finances due to stigma. So this kind of sets the foundation for understanding the cycle of financial strain. So how these pressures build and how to affect people's well-being. So I'll walk through that next. Next slide, please. So this is the cycle of financial strain. So it's a visual representation showing how financial stress escalates into crisis. And it kind of illustrates why texters reach out for help. So we can see moving clockwise from financial strain, that financial strain leads to anxiety, shame, and self-blame, where many texters feel they have failed and can't tell anyone about their financial situation. And this leads to social withdrawal, so avoiding friends or social activities due to embarrassment and also financial constraints. This results in texters feeling disconnected and without support, essentially feeling trapped. So what we see is that behind every conversation about financial worry is a story of fear, isolation, and the hope for understanding. And texters come to Shout at a point where the emotional impact feels overwhelming and they just need someone to talk to. So in most cases, texters aren't seeking financial advice. They are seeking emotional validation, a non-judgmental listener, and a safe place to express shame and fear and hopelessness. Next slide, please. So despite the intensity of the issues that texters face, many report positive outcomes from their conversation with Shout volunteers. 78% said the conversation was helpful. 61% felt calmer afterwards. Over half contacted us because they wanted someone to talk to who doesn't know them. 59% felt more comfortable texting than speaking. And 10% told us they had no one else to talk to. So this generally highlights the value of anonymity and the importance of providing accessible emotional support for people dealing with financial stress. Next slide, please. So I want to share a couple of direct quotes from texters. These really capture the difference volunteers make and remind us how meaningful a compassionate, non-judgment conversation can be during a financial crisis. Next slide, finally. So thanks everyone for listening. I hope these insights have helped to highlight the emotional complexity behind financial difficulties and the vital role that services like Shout play in supporting people through these crises. I'm happy to answer any questions at the end. I'm going to hand over to Antony from Payplan. Thanks everyone.
Thank you, Stella. Lovely to be here with you all today. So much of what Stella was saying resonates with us within our service. And so we're really delighted to be here to just try and really share what we can do to support people that are in financial crisis and struggling with debts. So my name is Antony. I'm one of the partnership managers at Payplan. I'm just going to share with you a few slides on who Payplan are and what service we provide to those that are struggling. And whether that's any of you here today yourselves or whether it's the communities that you support, our help is available to everybody. So Payplan itself, we are a completely free of charge, regulated debt advice provider, but also debt solutions provider. And we've been offering free and confidential debt services since the early 90s, as you can see, 33 years. Originally set up as a dedicated debt service for the police, but now we help anybody within the UK that needs free support. One of the things that we often hear is that people feel very alone. There's some key words on Stella's slides: isolation, stigma. People often feel that they're the only ones that are probably going through a debt problem at the time, and it can be hard to make the first step. So one of the things that we always like to reassure people with is that you're not alone. People are not alone struggling with debt. And as you can see here, we actually help over 4,500 people every single week with free debt advice, either coming through our free phone service or a range of online services that I'll share with you in a moment. We're very proud as well to offer a very holistic service because we don't want to just offer the advice that people need. We want to be able to offer a full range of debt solutions and support all in one place so that when people reach out and get the support, they can get everything they need in that one conversation with us or from that one organisation. We spend a lot of time listening to feedback from those that come through our service as well, because we can learn the most from them and we want to be able to shape our service for the future. And you'll hear some of the new initiatives that we've been implementing in the slides later on. And it's all good and well, myself and my colleague Emma that's here today, us coming here to say we're free, we're trusted, we're regulated, but it's really important that you hear that from someone else as well. So we're recommended by the Money and Pension Service, who are an at-arm's length government body. They'll only recommend free services that they trust, and we're one of those. Next slide, please, Frankie. One thing we thought we'd share with you is that as well as seeing more people come to us at the moment, because I mentioned earlier, we're seeing 4,500 people a week coming to us. That's grown tremendously through the cost of living crisis. 2 years ago, we were seeing about 2,400 people coming to us per week. So it's gone up by over 2,000 people per week. We're also seeing changes in really the issues that people are coming to us with and the types of demographics in terms of people coming to us. So I'll just go through a few of those here. The first one will probably be less surprising. We are seeing more homeowners coming to us that are struggling because their mortgages have increased and perhaps they have credit card debt and other debt accounts that they're struggling with and can't just make ends meet. We're seeing the average debt level increase. So that now stands at £17,000 per person coming to us. And it's very rare that someone comes to us with one single debt problem. The average is 7 debts per person that they will be juggling, and that can become quite overwhelming. We are seeing more of Generation Z coming to us as well, so the younger demographic, and we've really listening to that and responding to that to make sure that we communicate with them in a way that they prefer, and we're looking at the different types of debts and problems they're coming to us for support with. And also we're seeing an increase in higher earner households coming to us for help. And we always like to spotlight that because there can be a common myth that there's only certain demographics of people that need debt support. And the reality is it's everybody. If you earn more, you perhaps borrow more, you may become in financial difficulty like everyone else. And we're also seeing a growth in people that are coming to us with priority debts, such as council tax, rent arrears, mortgage arrears as well. Next slide, please, Frankie. When someone comes through to us, it's really important that we look at a very, I say earlier, holistic approach and looking at the full debt circumstances and giving them that wraparound care. So one of the things that we do when someone comes through to us to get debt advice, we listen, we ask questions, and we find the right solutions to match their needs. But we also give them lots of support and advice around the types of debts they have, such as priority debts and non-priority debts, wraparound care, because quite often people will disclose further support needs that they have outside of debt help. We also want to make sure that we're focusing on a broad range of debt problems and communities. So not just working with people who are employed, unemployed, retired, but also self-employed, which is quite rare, but we specialize in that. A full range of debt solutions all in one place, and also help with maximizing income and minimizing costs is really essential, and just building stability into people's finances. And it was really interesting earlier hearing the changes with texting and the rising levels. We see the same thing. We used to see far more people coming to us over the phone, where now really digital is leading the way. And that goes hand in hand with people not wanting to perhaps talk out loud about money sometimes. They want privacy. They want to do things in easy steps and simple steps. So as well as telephone, we have live chat, text messaging, our main website that people can get support from. One option that's become incredibly popular with us is WhatsApp, and giving people the ability to communicate in another channel that is familiar to them and can bring some level of comfort. Email as well, very important, and also signed video. And I'll let Emma talk about that a little bit more in a moment. Next slide, please. And just to finish off with, before I hand to Emma, we appreciate that digital services won't be right for everybody, hence why we will always offer telephone. But as I said earlier, we are seeing more and more people coming to us for online support, and that's for a number of reasons. Unfortunately, a lot of people do feel stigma associated to debt problems, and that really shouldn't be the case, but unfortunately can often be so. So some people don't want to talk out loud, and they might feel more comfortable working with us online. Some people, it's about really that ease and just convenience. It's easier perhaps to talk in the evening when children have gone to bed or outside of their busy life. So lots of reasons why we offer online digital support for those that need that. I'm going to hand to Emma, who'll talk to you about the range of services we provide to our most vulnerable clients.
Thanks, Anthony, and it's really lovely to be with all of you today. So thank you so much, Frankie, for inviting us over today. So my name's Emma, and my title at Payplan is actually Vulnerability Lead. And that really, in a nutshell, is to ensure that clients that are coming to our service that do present with those wider support needs, such as mental health issues, they really get the support and the adjustments are made that are really, really needed. So what do we do then? What do we do at Payplan to ensure that that happens? Well, we have dedicated vulnerable client teams across all of our different operational areas, and that's really from that first point of contact all the way through to a client completing their debt journey. And that ensures then that the support is mirrored throughout the time that the client is with us, and that really ensures the best possible outcome. So we're making the adjustments, we're listening to their needs, and we're responding accordingly throughout their time with us. And in that team, the advisors that we have, it's a very ring-fenced teams that are in those operational areas, but they're highly trained to be able to work with those individuals and pick up on those different indicators and offer that layer of support. Having said all of that, Of course, vulnerability can happen to anyone and at any time. So it's really important that any of our advisors across any of our areas can also react accordingly. They build that trust, they build that rapport, whether it is over the phone or over that digital platform. And through that, we train all of our advisors to do that. And we use lots of different conversation models that can really support them with those interactions and those conversations. We've done that not only because it's culture and it's the right thing to do, but we're currently seeing 54% of all of our clients are presenting now with wider support needs. 18 months ago, that was 34%. So again, you can really see how the cost of living crisis is really driving this additional layer of complexity. Their needs are multifaceted and they are becoming much more complex. Because of that, we've worked very hard on triage processes, asking more questions, to the point where 92% of our clients will actively disclose to us what their situation is. And of course, practical support is really important as part of those adjustments. So we use lots of different tools, such as the debtor mental health evidence form and the economic abuse evidence form as appropriate. And of course, building relationships, working collaboratively, just as we do with Shout, is vitally important so we can offer that holistic approach as well. Next slide, Frankie, please. Thank you. And just to build on the data that's already been shared with you, when we've done a recent survey, this is the impact that our clients have said to us that it's had on their mental health, and really thinking about that financial strain that was mentioned earlier. So 85% of our clients said being in debt had impacted their mental health. I won't go through all of that because of time, but it's the blue column at the end really that we really want to focus on, and the positive effects. We call it life after debt, and these are really the impact that reaching out for free debt advice can have. So 93% said it improved their mental well-being and stress levels reduced. That in itself is huge, just taking away that kind of like barrier in itself. 73% found their online journey good for their mental health, not having to talk about things, verbalize things again, really supported with that. 95% felt more confident about managing their money moving forward. Going through that budgeting exercise really helped them to move forward with that. And then 69% felt they can open up to friends and family about their situation. So having a layer of support that just wasn't there before. Next slide, please, Frankie. And because we've seen so many more of our clients now interacting over our digital platforms, we have our keyword partnership with Shout. And this has been really important to us, and we know the difference that this has made to so many people that have accessed our service. And simply texting the word refresh over to Shout, and those amazing volunteers, they will know straight away that point is a mental health crisis, and they can start those interactions to help and support further. Next slide, please, Frankie. And any client and any organisation that we work with can access support. And how we support different organisations is to set them up with secure referral links or with landing pages. Again, just to really take away that stigma and that embarrassment of maybe picking up the phone, or ensuring that they can interact with us over those digital platforms. And we can certainly do that for any organisation that is on the call today, should they choose to do so. Next slide, please, Frankie. Sorry, I think we might have missed one out, so that's not a problem, but don't worry. So I'll hand over to Leah, who can carry on with the presentation.
Thank you. Hello, everyone. Thank you for joining. My name is Leah Maragiou. I'm a clinical manager for the Shout service. So following those really interesting presentations, we will look at more research findings and focus on the connection between financial struggles and mental health, and also take a little bit of time to think, how can we support ourselves? How can we support other people or people that we work with at times of financial challenge? Slide, please, Frankie. Thank you. So the rising inflation, cost of living pressures, economic uncertainty have been having a major impact on people's lives in recent years in the UK and around the world. In 2023, almost 1/3 of UK adults reported feeling anxious in the prior month because of their financial situation, and many feel unable to cope. Under financial pressures and unemployment, people's well-being is declining, and pre-existing mental health struggles tend to worsen. Anxiety and depression can take over, affecting sleep, everyday life functioning. Relationships can suffer too, feelings of shame, low self-esteem, like we've seen earlier, all that can lead to isolation. And we know that isolation can then lead to suicidal ideation. Looking at the link between financial struggles and mental health is really important. As we saw earlier, financial difficulties can affect people of all ages, even young people and children. Furthermore, research has shown that even perceived financial hardship, regardless of the objective income, has been associated with increased risk of developing or worsening depressive symptoms. So all that doesn't only affect people who are facing financial problems, but also people worrying very much about their finances. Next slide, please. There are 8 dimensions to our well-being, and creating a balanced life requires our attention to all of them. Connecting and attending to the 8 dimensions serves to help build our resilience and emotional confidence. Because inevitably in life, we're going to encounter challenges and hardship, and being resilient enough to be able to cope requires us to be prepared. We tend to be better at some than others. For example, we might be doing really well focusing on our physical dimension through exercising or eating healthy, but we might struggle with attending to our emotional well-being. Or we might be paying close attention to our thoughts and feelings, but struggle with socializing. And maybe by looking at those dimensions, you can see which ones you might be focusing a lot of time and energy on, and others that maybe you need to be paying a little bit more attention to. So today we will focus on the financial dimension that involves a sense of stability in life. Attending it can involve simplifying our lives, as the more we own, the more stress we get, creating a sense of control and security. And of course, this would mean different things to different people, but we all have a need to feel safe and work to ensure that that is sustainable. Next slide, Frankie, please. Thank you. One more click, please. Thank you so much. Money problems and mental health difficulties seem to be in a bidirectional relationship, meaning that the one affects the other. There are a number of neuroscientific cognitive science studies that suggest financial hardship, poverty, or stress associated with money concerns, as well as perceived scarcity, may impair cognitive function, decision-making, and even our brain structure. In a study of middle-aged adults, people that reported financial hardship had smaller hippocampal and amygdala volumes compared to those not facing hardship. And smaller hippocampus and amygdala volumes are involved in memory, emotional regulation, stress responses, and functions of the brain that we use for decision-making. Poverty and sustained economic adversity also increases chronic stress, which then reduces our cognitive bandwidth, impairing our attention, our working memory, self-control, planning, and decision-making. So it becomes very clear that people in financial hardship are not only dealing with money issues or unemployment, but face much bigger challenges affecting their physical, neurological function, and making it a lot harder to make the necessary decisions and take appropriate actions toward changing and improving their circumstances. Slide, please. And if we now look at people who are struggling with their mental health, we can see that they are 3.5 times more likely to experience problematic debt than those without mental health challenges. So mental health issues can lead to loss of employment or underemployment, making financial stability really hard to maintain. Also, people with depression struggle with impulsive and inconsistent decision-making that can get them in financial trouble. And all this leads to a vicious cycle where problems in one area will trigger or amplify problems in another, leading to long-term instability and poor quality of life. Slide, please. So what can we do to support ourselves or support other people? Going back to the dimensions that we saw, there are things we can do to maintain our physical and emotional well-being that are also intertwined. It's important to remember that it takes time and work and practice to build and maintain those habits. It's not something that we can do as a coping skill when things are hard, because let's face it, when things are hard and we're struggling, we are not really in a position to build on those good habits. Rather, we should aim to focus on them when we are in a good place, when we have capacity, to help us prepare for when things will inevitably get hard in life. The more tools we have in our toolbox, the better equipped we are to deal with issues and use them when we actually have to. So looking first at the physical dimension, everything that has to do with our bodies, it's particularly important to focus on our sleep quality because it has a massive impact on our physical and mental wellness, as well as our cognitive functions and focus. And I'm sure we can all relate to how hard and difficult everything feels after a sleepless night. So establishing sleep routines can help us wind down. Avoiding screen time, for example, can be very, very beneficial. And lastly, exercise can be a great way to clear our bodies, minds, and help us think more clearly about the next steps that we need to take. Thank you. Looking at the emotional dimension, which involves our thoughts and feelings, perhaps you're already aware of this link. Our thoughts affect our feelings affect our behaviors. For example, if I keep thinking and telling myself, I don't have enough money, I'm not going to make rent, that will make me feel very anxious, very low. And by being anxious, I will struggle to think clearly. I will struggle to make plans. And by feeling very low, I might try to comfort myself and end up splurging all my money. It's really hard to change our behaviors, but it's not so hard to change our thoughts. If we pay attention to what is going on in our minds, recognize the self-talk, realize that our minds lie, and we can always trust them, we can gain a feeling of control and choose to act more mindfully.